Okay, this video is called Meat, Acidosis, and Kidney Functions, about how to protect your kidneys, which also protects your overall health. And we're going to start out with Hamlet. Hamlet, on the top of the castle tower, sees the ghost of his father. And it is wise when you study nutrition to remember sort of the founding fathers of nutrition, like Walter Kempner here, speaking to Hamlet. Also, Dr. John Mcdougall. In this picture, sort of a Horatio version, but another founding father of nutrition. They'll set you straight on the kidneys. And then you must beware of people trying to trick you. And there's a lot of them. And it goes all the way from, obviously paleo, keto, carnivore, but also the university phonies that recommend the Mediterranean diet, which is a joke. And the high-fat phonies recommend the vegan Mediterranean diet, which is much, much better, and many of them are very smart. You can learn a lot from them, but they also BS on some issues. And that will come up in this talk. Okay, so here is Hamlet, and he's holding out a flute, a recorder, so to speak, in front of Guildenstern. And Guildenstern, Rosencrantz and Guildenstern are trying to manipulate Hamlet and to trick him. So Hamlet says to him, "Will you play upon this pipe?" Guildenstern says, "My lord, I cannot." "Hamlet, I pray you." Guildenstern, "Believe me, I cannot." Hamlet, "I do beseech you." Guildenstern, "I know not the touch of it, my lord. I have not the skill." Hamlet, "Well, why look you now? How unworthy a thing you make of me. You would play upon me. You would seem to know my stops. You would pluck out the heart of my mystery. You would sound me from the lowest note to the top of my compass. And there is much music, excellent voice in this little organ. Yet you cannot make it speak? Splud, do you think I am easier to be played upon than a pipe? Call me what instrument you will. Though you may fret me, you cannot play upon me. That's right. We're too smart for this BS. They're not going to trick us. Okay, so here's the kidneys. The kidneys make urine. The urine goes through the ureter, goes down into the urinary bladder. That's the ureteral jet when it squirts into the urinary bladder, and then we excrete it from our body through the urethra. Okay, here's a more detailed picture of the kidney. The renal artery comes into the kidney, and then it pumps blood into what is called Bowman's capsule. The kidney is a filter. It filters the blood to remove waste products from the blood. The most important thing the kidney does is remove nitrogen. Nitrogen only comes from protein. There is no nitrogen in fats or in carbohydrates. So what this means is that when you eat protein, you automatically increase the workload of the kidneys. And the protein coming from animal protein increases the workload much more than does plant protein, because animal protein has more acidity. It has more sulfur-containing amino acids like methionine, cysteine, and those are in part metabolized to sulfuric acid, causing a low-grade metabolic acidosis. Meat just also leads to more systemic inflammation that's going to increase the workload on the kidney. You get something called hyperfiltration in the kidneys. You get increased intraglomerular pressure in the kidneys. Okay, so anyways, once the blood is filtered into the Bowman's capsule, the urine material now passes through the proximal tubule, then it goes through the distal tubule, then it goes out and it's excreted into the urine, okay, to the ureter, to the urinary bladder, like I just showed you. During this time here, the kidney has some ability to reabsorb things. In particular, for our purposes today, it can reabsorb some bicarbonate, which is very much like CO2, and it's a basic chemical that makes your blood more alkaline. So bicarbonate is your friend to make your blood more alkaline. The kidney can also secrete protons, acid protons, into the urine. So those are some of the things that the kidney does to maintain a normal pH of the blood. You need to maintain a normal pH because all your enzymes will function better in a normal pH. pH is a measure of acidity of the blood. Just to get a little sense of kidney function, usually people are considered to have significant kidney dysfunction, early kidney failure, when they get a GFR, glomerular filtration rate, that's GFR, below 60. So when it's below 60, you're in stage 3, and that's significant kidney failure, significant kidney dysfunction. You start getting in big trouble when GFR drops below 30, then, a lot of medication dosages are changed and acidosis starts getting significantly worse. When you're down below GFR around 10, then you're kind of screwed because you're going to have to go on dialysis. Okay, so you're probably going to have to go on dialysis. Some people can make great recoveries, but in general, usually the kidneys are screwed. Kidney cells don't regenerate, so you're not going to recreate kidney filters, nephrons they're called. So what you want to do is protect the ones you've got. Okay, so now here is Hamlet talking to his mother, and here's what he says. Well, here's the queen, Queen Gertrude, and she says, Hamlet, thou hast thy father much offended. Hamlet, mother, thou hast my father much offended. Queen, come, come, you answer with an idle tongue. Hamlet, go, go, you question with a wicked tongue. Oh, shame, where is thy blush? I must be cruel only to be kind. Okay, so where am I going with that? What I'm trying to say is, I need to tell you the truth, and the truth can be kind of blunt, unpleasant, almost seem harsh. But you need to know the truth so that you can make intelligent decisions. And that's where the line of I must be cruel only to be kind comes into meaning. Okay, so now we're going to start getting into some of the real important stuff. And first of all, one more quote from Hamlet. This is from Act 4, Scene 4, where Hamlet says, how all occasions, and let's put the word meat in there, for all occasions do inform against me, and spur my dull revenge. What is a man if his chief good and market of his time be but to sleep and feed? A beast, no more. Surely he that made us, with such large discourse, looking before and after, gave us not that capability of godlike reason to remain in us unused. Okay, so what Hamlet's saying is, we got a brain. We can use it. We're better than the animals, the beasts of the field. And what I'm saying here is that the more you look at meat, the worse it gets. I gave a previous lecture, does meat increase the risk of cancer? And it increased the risk of cancer in about 30 ways. So that's not an accident. That's not a coincidence. It just does. Okay, and meat also increases your risk of kidney failure. Okay. The more saturated fat you eat, the more proteinuria you have, the more increased permeability of the glomerulus in an abnormal way, and you start leaking protein like albumin into your urine. And the more albumin you leak into your urine, the faster your kidneys deteriorate. Okay, so again, we talked about the kidney regulates blood pH, acid-base balance, and it is able to alkalinize the blood. It can excrete protons, acid units, into the urine. It can reabsorb bicarbonate, the base, that's like CO2, from the urine back into the blood. Normal bicarbonate levels in the blood are about 23 to 29. Okay, it's less able to reabsorb this bicarbonate when you've got CKD, that's chronic kidney disease. The kidney also can make bicarbonate when it's healthy. Again, you're going to make less once your kidneys are in failure. With chronic kidney disease, you can get a drop in serum bicarbonate, and that's associated with worsened metabolic acidosis of chronic kidney disease. Sometimes it's called uremic acidosis. When the bicarbonate continually in the blood is abnormally low, like less than 22, you'll get more rapid failure of the kidney, more rapid worsening of GFR, glomerular filtration rate. And this worsening of chronic kidney disease is associated with more rapid death. You die sooner. Okay. The main source of dietary acid comes from eating meat, like we talked about. Meat has a lot of protein because it doesn't contain any carbohydrate other than milk. So meat's got lots of protein. Like a typical meat food is salmon, okay? Salmon is 50% protein and 50% fat, so that's a lot of animal protein. Okay, now what's the opposite? The opposite food is like fruits and vegetables. Fruits and vegetables are the main source of base instead of acid. Base is like the opposite of acid. They're very alkaline. So eating more fruits and vegetables will lower your acid load. So the smart move to protect your body from metabolic acidosis is to avoid all animal protein. And you even don't want, especially if you got kidney failure, you want to minimize your intake of plant protein also. Plant protein, again, like we said, it's much less acidic than animal protein, but it's still acidic. I mean, amino acids are called acid because they contain some acid. Okay, you want to eat more fruits and vegetables. You have to be careful in end-stage kidney failure because there's a lot of potassium in there, but that's usually not until your GFR is really, really low, like less than 15 or so. Metabolic acidosis is associated with the need to buffer the pH. So some of the ways the kidney will respond to metabolic acidosis, it'll secrete or excrete more hydrogen ions into the urine. This will be coupled with excreting calcium. So you will simultaneously put calcium into the urine when you put protons into the urine, the acid into the urine. And this will increase the risk of kidney stones because you're putting more calcium into the urine. That's called calciuria. The loss of calcium from the bones is associated with osteoporosis. So you pee your bones into the toilet, but you also lose calcium from your muscles. And this is associated with muscle wasting. It damages your muscle proteins. You lose muscle protein. So notice how your metabolic acidosis is going to be associated with a loss of bone and a loss of muscle. In children, this can cause suppression of growth with chronic kidney disease. Okay, this is also why I don't believe that old people need to eat more protein. This is one of the reasons, because when they're eating more protein, and they get tons of old people have kidney failure. One of the things I've done in my life is I've worked in a CAT scan area, and in a CAT scan area, they look at the patient's GFR every day, all day long. All the patients that are going to get IV iodinated contrast for CAT scans, and also if they're going to get gadolinium contrast for MRIs. And I can tell you, tons of patients have GFRs less than 60, tons of them. And it used to be we wouldn't give contrast to people with GFRs less than 60, then it was GFRs less than 45, now it's currently like GFRs less than 30. It depends on the circumstances, whether or not they're on dialysis, but the point I'm making is tons and tons of people, middle-aged and older people, have some degree of kidney failure. You see it all day long. Ask anybody that works around these patients. Tons of them. It's routine. You expect them to have abnormal kidney function as they get older. And so what I'm saying is this is associated with osteoporosis. It's also associated with muscle wasting. Well, that's exactly what people don't want, is to have weakening of their bones, softening of their bones, and weakening of their muscles. So this is another reason why you don't want to be eating meat, okay? And I actually, try not to go too heavy on the beans. Dr. Mcdougall would say that too. You don't want to overdo it with the beans, especially if you had cancer, because then you're increasing your protein load. So what I'm saying is a real high protein load is bad for your kidneys and it's bad for your cancer risk. Okay, CKD. Let's see what else here. Kidney calcifications. These calcifications co-secreted into the kidney tubules. They can sometimes precipitate and plug up kidney tubules, even if they don't form a frank symptomatic kidney stone or an obvious big stone on CAT scan or ultrasound. They can still be plugging up your tubules and cause decreased kidney function. Okay, and so like I said, meat is bad for you in so many ways it's not even funny. Like I said, it causes cancer in about 30 different ways. It increases your risk of kidney stones, increases your risk of osteoporosis, increases your risk in your older years of muscle wasting, of kidney failure. So this reminds me of another quote. When sorrows come, they come not single spies, but in battalions. Hamlet. Okay, and then all the paleo keto carnivores promoting all this meat diet. Here's what I have to say to them. Oh villain, smiling damned villain, that one may smile and be a villain. Yeah, it's amazing. It's like there's a lot more people on the internet lying to the pros than telling them the truth and trying to help them. So CKD, chronic kidney disease, is associated with metabolic acidosis. Worsening metabolic acidosis is associated with progressive kidney fibrosis and loss of GFR, glomerular filtration rate, worsening kidney failure. When your kidney failure, once you go on dialysis, not only is it a pain in the butt, you have to sit in that room on that machine about 5 hours, 3 times a week, but you also are at very high risk to die soon. It's like having an aggressive cancer. 50% of dialysis patients are dead within 15 years. So people don't live long once they go on dialysis typically. Metabolic acidosis, you get more rapid progression of CKD and you die sooner. Okay. You get worse acidosis with animal protein. Also, everything is accelerated and worsened if you're smoking cigarettes, if you're fat, and the more protein you're losing into the blood. There's other reasons for losing protein, but that's a big topic. I'm going to get down to that later, okay? And you don't want to have a high protein intake. I mean, that's also a problem. There's a good paper. I'm going to go over this paper now. All that stuff was a warm-up to going over this paper. It's by Mcdougall. It's about metabolic acidosis and chronic kidney disease update from the American Journal of Kidney Disease 2016. So now we're going to go through some of the stuff from that paper. So here's the paper here if you want to look it up yourself. And it talks about how when patients have progressed to the point where they're dropping and lowering their serum bicarbonate, then they have much worse prognosis. Let's see, what's interesting in here? Well, it's mainly just going to talk about the acidosis here. I went through what's in this paper with my slides that I just showed you a moment ago, but here's some things that I think in particular are interesting. What are the adverse effects of metabolic acidosis in chronic disease, chronic kidney disease, like we talked about? Muscle protein wasting, so you get weaker. Dissolution of bone, so you get osteoporosis. Decreased albumin synthesis. It's a real small protein in the blood, the one that's lost first with kidney failure. And so you're going to make less albumin, and that's a problem because you need that albumin in your blood. It's a normal thing. It's a carrier protein for a lot of things. It maintains oncotic pressure in the blood. You'll get worsening chronic kidney disease. Okay, those are the key points. And the bottom line is you die sooner. Okay, now here's another interesting point. When you have an increased degradation of muscle protein, that can occur even if the serum bicarb is normal, you'll get a problem in postmenopausal women besides the osteoporosis. You'll get more degradation of muscle protein. So that's exactly what you don't want. And I say that because there's a lot of people saying, oh, old people need more protein. Old people need more protein. I don't see all these backward ass, illiterate blue zone people, taking protein supplements, when they get older. And I worry about it. I would never take a powder protein supplement. They tend to contaminate those with heavy metals. There's Consumer Reports has written several papers about that. Albumin synthesis in the liver is compromised by metabolic acidosis. Kids who have kidney failure don't grow well because it's interfering with the bone and the muscle, the metabolic acidosis. Okay. Let's see. In this study, patients with GFRs over 60, the lower their serum bicarb, the more rapidly their GFR worsens. So you're kind of screwed when you go down this path. So what's the smart thing? Stop eating meat. Don't eat one bite, not one bite. Eat more fruits and vegetables, okay? And decrease your dietary protein. Those are things you can do to protect your kidneys. So anyways, that's it. I hope that was helpful for you. And yeah, those are the big lessons from this lecture. Was you don't want to eat any meat. It's bad for you in numerous ways. Besides causing atherosclerosis, increasing your risk of diabetes, increasing your risk of hypertension, increasing your risk of kidney failure, increasing your risk of cancer, increasing your risk of dementia, it makes you fat, sick, and stupid. And then fruits and vegetables are your friend. They're alkaline, so that is good. But be careful if you've got kidney insufficiency. You want to minimize your dietary protein. So you got to watch out for high-protein plant foods like beans. And there's some other ones as well. So anyways, hope that was helpful.